Hi friends, welcome to SPOTTERZ. What we are going to do in the SPOTTERZ series over the next 3 weeks or so, the final countdown lap for your exams, is we are going to deal with the most important and therefore the most expected images in your upcoming NEET-PG 2024 exam as well as your July session FMG exam. So whatever images are those which are most likely to be asked in your upcoming exams, we are going to see those images, we are going to discuss the findings, we are going to quickly revise certain important high yield points related to those images. So this is going to give you the last minute booster pack for your preparation in the upcoming exams. So let us jump right into the first such image that I want you to see and know for your exam. Now this was an elderly patient who came with altered bowel habits, tenesmus and blood in stools. What do you see here? This is a barium enema image. Now let us look at the findings in this particular image. We are going to take the help of Magic View graphics here. Now if you look at this particular image, you'll be, let me show you a few important findings in this particular image. So this over here that you see is going to be the colonic outline. And can you see there is a narrowing involving the colonic lumen? Why is it so? There's a narrowing involving the colonic lumen because, right? So this is the shape of the narrowing. Why is there narrowing? Because there is a circumferential tumor which is located along the colonic wall, right? The surface of the tumor is extremely irregular. You can see the mucosal irregularity there, and this is creating a shape like that of what? So this looks like what? This looks like the apple core sign or apple core appearance is what this is called. And apple core sign, apple core appearance has been described in what? It has been described in, yes, CA colon. We all know that. One small thing I want you to know, that it is more predominantly seen in left-sided colonic cancer as compared to right. So left-sided colonic cancer means that involving the sigmoid colon, the descending colon more likely than the cecum and ascending colon cancer. So this is what is your apple core sign or apple core appearance of CA colon. Now let us quickly look at certain specifics related to CA colon. So colorectal cancer, the most important site, remember, is this. So most important site is the rectum. Yes, but if this asks you specifically what is the most common colonic site of involvement of colorectal cancer, then remember it is the sigmoid colon. It is the sigmoid colon. So most common site of CA colon, CA colorectal cancer is the rectum, but if they specifically ask you what is most common colonic site, it is sigmoid colon. The best modality for screening, remember, is colonoscopy. Best modality for screening is colonoscopy. What time should you start screening? At what age should you start screening? Routinely, you should start screening at the age of 50 years. However, if there is a caveat to it, there is an exception to it, right? If there is a family history of colonic cancer, then in such cases you should start 10 years prior to the age at which the relative was diagnosed with colonic cancer. So if there was a family history of a relative being diagnosed with colonic cancer as at say 48 years of age, then it means that you should start screening at around 38 years of age, right? So that is what is the best time to start screening if there is a positive family history. Okay, what is the most common site of metastasis? So the primary is in the sigmoid or the rectum. It most commonly metastasizes, yes, to the liver, correct? What is the investigation of choice for diagnosis? So they give you a history and this image, the apple core sign, and they ask you what is the next best investigation for diagnosis. Remember, then it is going to be colonoscopy. That will enable you to have a look at the tumor directly, and along with that you can also do a biopsy of that particular tumor or the lesion. That will give you a more definitive diagnosis. If they ask you specifically what is the investigation of choice for staging, remember, then usually for any cancer, remember, the investigation of choice for staging is PET CT. Why? Because it is going to help you diagnose metastasis, detect metastasis. And investigation of choice for TN staging, if they ask you, it is going to be MRI with a endorectal coil. MRI with the endorectal coil is going to be investigation of choice for TN staging. So this is how the colon would look like on CT. You can see the rectal wall, colonic wall, and you can see the heterogeneous mass lesion along its wall. Another image, see anteriorly, this is the urinary bladder. Here you can see the hip joints bilaterally. You can see the rectum behind the urinary bladder, a mass lesion along the wall of the rectum, which is also enhancing in a heterogeneous manner. So this is how it is going to look like on CCT. Right, on PET-CT, yes, you can see these all metastases which are going to light up, right, immensely, right. So these are all the metastases that you are going to detect on PET-CT. So PET-CT is the investigation of choice for staging. Remember friends, by these SPOTTERZ sessions, we are going to take a few small steps every day that is going to add up, eventually make a very significant difference in the outcome of your exams. Let us rock this particular exam together. Thank you.